Let's continue our lecture on home accidents. Now on strangulation, the children may strangle themselves accidentally when clothing or beddings get caught on furniture, particularly young children, in courts. Following some incidences, there is possibility of strangulation on curtain cords. You see here the nature of this baby cot here. You see the child's legs or hands can get caught up in these spaces here. Whereas when you compare with this is a bit better off because there's less possibility of a child getting caught up in this. And therefore, the most important thing is being vigilant to identify those instances whereby a child can easily get caught up in this furniture. Alright, then drowning is also among the accidents that can easily occur at home. Drowning refers to an event in which a child's airway is submerged or immersed in a liquid, leading to an impairment in breathing. The outcome can be fetal or non-fetal, and in that case, there is significant neurological damage. Babies and toddlers tend to drown in bathtubs. It can be in a basin, a wells, a bucket, a swimming pool, or a garden pot. Wherever adults or those older children, they get difficulty in canals, lakes, and seas. If water is cold, it results into hypothermia and the presence of hypoxia. Resuscitation should be continued until the child is warm as up as recovery may still be possible. So generally in drowning, mechanisms of death include hypoxia and then hypothermia. So how would you manage a child who has been rescued from drowning? Immediately what you do is you do primary survey. Immediately after rescuing the child, you do a little primary survey. It may include checking the clothes the child was wearing, removing those clothes. After doing the primary survey, then immediately you put the child on a flat surface. After putting the child on a flat surface, open the airway. After opening the airway, then you can do a chin lift. And do a chin lift of a child. That includes placing one hand on the tip of the head, using two fingers of the other hand to do a chin lift. Then you can give them, then you put your mouth and form a seal around. Take the hands from the forehead and pinch the soft part of the nose closely. Allow the mouth to fall open with the head still tilted. Take a breath and put your mouth around the child's mouth to form a seal. After forming that seal, of course, you're going to give them what they call a keys of life. Let me clean our slide here and I show you. Okay. So as demonstrated here, according to here, you see, these are two fingers here, tilting the head slightly, and then here there is one on the forehead, and then she formed a seal around. So then you give a breath of life. See? Blow into the mouth gently and steadily for up to 1 second until the chest rises. Then watch the chest fall. Take one breath. Do this 5 times. So you can also give, after that, you can give chest compressions. Kneel by the child and put the hand in the center of the child's chest. Commence chest compression. Give chest compressions at least at a rate of 100 to 120 compressions per minute. Continue to perform cardiopulmonary resuscitation, or alternatively, you can give 30 chest compressions with the 2 rescue breaths until the child starts showing signs of being responsive. For specific management, assess the ABC, which means give oxygen and ensure adequate oxygenation, remove all the wet clothes, use an NG tube to remove swallowed water and debris from the stomach. When necessary, you can also do a bronchoscopy to remove foreign material such as aspirated debris. Then warm the child externally. After warming the child, you can either use a radiant warmer, radiant heater, or give warm blankets. Then check for hypoglycemia and electrolyte imbalance, especially hyponatremia, which increases the risk of cerebral edema. Then you can also give antibiotics for possible infection if there are pulmonary signs. Then our last accident at home that we are going to look at is glass-related injuries. Broken glasses can cause serious cuts, and so use of the materials around the home in furniture or fitting should be carefully considered if you have a young family. Finally, falling objects. When children start to move around on their own, there is an increased danger of them falling onto objects or pulling objects, and those objects fall on top of them. So being conscious of your child's health means making sure that any trailing electronic materials, tablecloth, dish towels are out of reach in order to help prevent these accidents from happening. Thank you. I hope you enjoyed. I hope you've learned something. Enjoy your day.